Good morning, good afternoon, good evening, and welcome to the next in the Lancet Commission seminar series on gender and global health. And I'm absolutely thrilled to welcome everybody today to three presenters. We will have our Commissioner, Fram Baum, who's the Distinguished Professor of Public Health at Flinders University in Australia. And she is joined by Faye Warner, who is the CEO, and Cleone Wellington, who's the Cultural Manager of Wominda. And we'll be hearing more about Wominda, I'm sure, during the talk. But Wominda is an Aboriginal women's health organisation based on what I'm told is the extraordinarily beautiful south coast of Australia, just south of Sydney. So I'm Sarah Hawkes. I'm one of the co-chairs of the Lancet Commission. I'm absolutely thrilled to welcome everybody today. If you have got questions for Fran or Leon or Faye, please put them into the chat below the YouTube channel, and we will leave a few minutes at the end for questions from everybody who writes into us. Thank you very much indeed, and I will hand over to you, Fran, Cleone, and Faye. Thank you.
Lovely. Thanks very much, Sarah. I'll just share this and start it. And whoops, we want to go, hang on, in show. Let's go to the, there we are, we're there. And I'd like to also say thanks very much to Cleone and Faye for joining us today, because I'm hoping that when we get to talk about Wominda, you will see the way in which theories can become very practical. And I'd like to acknowledge that I'm speaking from Adelaide, the colonial name for our city, but I'd also like to acknowledge that I'm on Kaurna country and pay respects to Kaurna elders past, present and future, and also acknowledge the resilience of Kaurna people through the processes of colonisation, which have been pretty brutal for Indigenous people in Australia. So when I was thinking about what I might say usefully for the Commission, I thought about what are we grappling with on this Commission on Gender and Global Health? And it seemed to me we're really dealing with complexity, with theories, with practice, with policy. And if you look at this slide, we clearly want to advance understanding, but we also want to be very practical, and we also want to come up with measures that will have outcomes. But doing this is very messy. So I've tried to show that rather than putting direct arrows. I don't think direct arrows are really the way that change happens. It happens through a variety of different methods that can include a range of strategies and policies and other actions. So that's just sort of setting the scenes for the complexity of the task that we've taken on in trying to determine how we advance global health through action on gender equity. And then I was thinking, well, you know, in terms of the understanding, I think there are many different understandings that we're bringing to our work. And I've listed some of those, and those in blue are the ones that we'll be talking about today, which include critical race theory, Aboriginal ways of knowing, being and doing, the concept of matriarchal societies, notions of decolonisation, and also Bourdieu in particular, I'm going to talk a little bit about. And of course, there's many, many strategies and ways of working, which I think include community mobilization, consciousness raising, the ability to walk in two worlds in colonized societies, community control of services, being an activist academic, and assuming complexity in what we do. And hopefully those kind of ideas and strategies will help us find the way to how we can improve health and how we can close those disease gaps. Now, I'm just going to talk very briefly about some work that we did, just looking at how we try to improve understanding using theories. And then I'm going to have a conversation with Faye and Cleone at Wominda. So we we took on the task as part of a project that we're having, trying to look at countries that sort of punch above their weight in terms of their economic level and gender. And we did a comparison of looking at Australia and Ethiopia. And what you can see there is the gap between men and women's life expectancy. And you can see that in Ethiopia, that gap used to be 6.2, but it has now, it used to be 6.2 in Australia, and it's now declined to just over 4. Whereas in Ethiopia, the gap, if anything, has increased. So we thought about how could we extend those, understand those trends. And we, of course, looked at a sort of sociological perspective and looked at the way that legal and political rights had made a difference, and of course looked at the role of the health system. But we also then tried to go a bit deeper by exploring everyday gendered practices through the lens of Bourdieu's capitals. And there we thought about the way that capitals reproduce and create inequities in society. And we were sort of building, Jenny Poppe was one of our authors, and Jenny and a colleague wrote us a couple of decades ago that it's vital to consider how the gendering of the social, cultural, material and ontological dimensions of daily life shape women's and men's health experiences. So we took this idea of capitals, which Bourdieu sees as underlying reproduction of privilege and also the sort of power distribution in society. And I can just got time to give you a really little insight into how well we did that. Well, we know that social capital, that social connections can increase an individual's power, status and resources. And we know that women are more likely than men to participate in social and community groups. We know that in Australia, we have strong gender movements, women's movements, gay, trans, and so on. And women are now more likely to be in trade unions, so perhaps be able to obtain better working conditions. But we also know that men are more likely to be lonely. So we're trying to explain why women continue to have a life expectancy advantage, even though in many ways, in terms of living in poverty, they're much more likely to do that than men. And then in Ethiopia, we found a real paucity of data. We knew that civil society participation had increased, that there was a very strong women's movement, particularly in Tigray. But of course, what we wrote after we'd sort of published this article, there's currently a civil war undermining solidarity, especially as a result of extreme sexual violence. And in both countries, the question of whether the benefits of community social participation outweigh the burdens of informal caring that so many women face. So then we looked at cultural capital, which of course is styles of dress, eating habit, verbal skills, scientific knowledge, educational credential. And we note that women have higher levels of education, but there is considerable discrimination on the basis of gender. We note that the cultural determinants of health are vital, especially for First Nations people, and we'll talk a bit more about that in a while. And the notion of cultural health capital is higher in men than women. And there is a direct link between economic capital, as high cultural capital increases access to employment. And in Ethiopia, we noted that women's education and literacy had improved, but at higher education levels, men are much more likely to be taking part in that. And I guess that we noted that in both countries, in reference to a recent UNDP report on gender inequality as basic capabilities, that maybe the gains have been reflected there and less in what the UNDP talked about, enhanced capabilities, for example, through access to higher status, better paid employment and more powerful positions in the business and corporate world. So I guess overall, our work trying to understand difference in the sort of life expectancy, of course, reinforces the way that there are many, many social differences, and the theory takes us so far. But what I'd also like to stress in this session is how are practical theories used in people who are informing their work through an understanding of the different theories that might affect the power balances, the form of services they can offer, so on. So this is why I really wanted to invite Faye Warner and Cleone Wellington to talk with us, because in our research group, we have a project on looking at decolonised health services, and Waminda is one of our partner organisations. And we've really been exploring with them the extent to which Aboriginal knowledges can inform their work and decolonisation. And also, I thought it would be helpful in conversations with Waminda. There's some interesting insights on how Western feminism can be helpful or not. So now we're going to have a kind of conversation. So Cleone and Kay, first of all, can you tell us a bit how Aboriginal knowledges inform the services and practices to Waminda? And I'll put the next slide on, which has your service model, which might help you sort of explain that.
Yeah, sure. Can I just start by acknowledging my elders, past and present, and of the traditional owners that are stand on the land today, and the 13 tribes and clans, and just like to acknowledge that all the hardship and the suffering that my people and my ancestors have gone through for me to actually be here today, to be able to speak. So I think thanks, friend, for introducing us. And I think the best way to start when speaking about Waminda and, our Aboriginal ways of being, knowing and doing, I think the best place to always start is where Waminda first came to be. So Waminda's been established in our community for 37 years. And when it was first established, it was established by strong Aboriginal women from our community. At that time, they were quite young women, and nowadays they are elders in community. So when they very first came to be and they first came together to create a service like Waminda, it was because of the racism of this town, and because there needed to be a space for our women to feel supported, to get the care that they needed, and to feel safe as well. So to have a safe place to go to. So for us at Waminda, being in operation for 37 years, it's very important for us to always stay true to who we are and stay grassroots and stay grounded. So Waminda's grown quite substantially over the 37 years. So for many, many years, Waminda only operated from one little house. And then we moved into now to this very day, we operate out of 7 different office spaces. We have over 120 staff, and we actually provide services to our communities from the Illawarra down to the far south coast. So it's quite a large area that we service now. But when speaking about Aboriginal ways of being, knowing and doing, when you look at our model of care, which is on the screen, you've got that circle on the outside, which is culture as foundation. So that's Aboriginal ways of being, knowing and doing. So what is it, who are we as a people? What's our belonging? What's our connection? What's our identity? All those things are intertwined with our culture. So what's our practices and protocols? And, when we're talking about law, what's our LORE law, not LAW law? And for us at Waminda, that keeps us grounded in who we are and never lose sight of that. And then what we do as a service is embed that through everything. So from the top to the very bottom. But for us too, we actually don't work from top to bottom. It isn't about that. It's about working together, being side by side, working for our community. And when you're talking about Aboriginal ways of being, knowing and doing, it's always paying respect and giving that honour to those before us and paving those ways. But then also, especially for us where we live, or this is my home here that we're on today, we had impacts of colonisation. So we were the first people to be hit by, by colonisation. So for us, a lot of our language and our culture was not lost, but it was just asleep. So it's been held by certain people in our communities up and down the coastline. So for us, it's about reawakening and actually practicing our culture on a daily basis, because it isn't lost. So that's our Aboriginal ways of being, knowing and doing. And then as a practice, we actually do that. We use language, we do ceremony, we create a culturally safe space for our families and our community. Our community has ownership over Waminda. We are community as well. So 75% of Waminda's staff members identify as being Aboriginal and from this community. and we all give back to our community. And for a lot of us, it's like people like to separate Wominda and say, you know, that's a service, that's community, but we are community. So community is us and we are community. So yeah, it's really important for us, you know, to really have that cultural framework within Wominda, and then that's guided by our cultural committee, which is made up of Aboriginal women within our service, and they're the ones who lead that.
That's great. And what about notions of decolonisation? And we've been talking about those on this commission. Could you tell us a bit about how you work to decolonise your service?
Yeah, sure.
The constraints of being in a colonial society.
Yeah, of course. You know, for being an Aboriginal woman, you know, we always speak about walking in those two worlds. So the two worlds is our culture, so our Aboriginal ways of being, knowing, doing, and then the westernised world, the world that we're being forced to live in. So for us, when we're talking about decolonising, we're actually talking about a lot of stuff. So we're talking about reclamation, we're talking about making a space that is owned by us, and really just taking back that power and getting to a place of self-determination. And when you're talking about a service and you're talking about Wominda and the way we deliver it, it's very different to mainstream services. So we actually flip it. We flip that. So what happens is, as a service, of course we have our policies, we have procedures in place, and there's risks, but our risks don't strangulate us. You know, we hold risk. Our community let us know what it is that they need. They let us know what the spaces need to be, what the services need to be, what programs. And so for us, that's around that decolonising. But a part of the decolonising as well is actually having our non-Koori staff, or non-Aboriginal staff who are in Wominda, which could range from all sorts of different people from all different walks of life and all different education levels, coming into our space as an Aboriginal organisation, knowing their place, knowing their purpose, addressing their white privilege, addressing their white fragility. And they do that together, and something we call it our imperfect allies. So then they come together, I think every 3 months it is, and they sit and they talk about, you know, what's their place, what's their purpose, being in an Aboriginal service, why are they here? Because we can't have people in our space, especially non-Koori people, who think they're here to save Aboriginal people, because we don't need saving. We just need people to come in, say, I'm here, I've got my skills, what do you want to do with that? So that's all around that decolonising. And, you know, and talking about that strength and resistance and that resilience for us, and being, you know, matriarchal and very, very strong women, you know, in our community, in this service, and lead this service day in and day out. And, you know, we have men in our space, and it's very recent in the last 5 years, but those men know their place in this service. They have to be led by the Aboriginal women. They stand beside us and walk beside us. But yeah, that decolonising framework or decolonising practice is exactly everything that we do within Wominda.
Yeah.
That's great. And I guess the sort of final question is, when we've discussed this before, you've sort of presented views in which Western feminism isn't necessarily a useful theoretical framework for you guys. Would you like to say a little bit about that?
Yeah, you know, for me, you know, growing up as an Aboriginal woman, I come from a very strong family, and I have very strong women in my family. Never once have any of those Aboriginal women ever talked to me about feminism. Never once have they ever talked to me about that movement. You know, I'm just learning about that now in my later ages. And for me, it's not, you know, that feminism, rights or ways, you know, when you talk about that, it doesn't fit. For me, this is talking to me personally, and when I speak about Wominda, that doesn't really fit within our service and the way that we do things, because yes, we're Aboriginal women led, and yes, we're very strong, we're very bold, and we're about our women's rights, but it's Aboriginal women's rights. And I feel like we were left out, we were left out of that movement within Australia. White women actually took that for themselves and didn't include the Aboriginal women in this country.
Yeah.
Yeah, I think, Fran, that what's been more and more understood about Wominda is that that white feminist framework and those feminist theories don't necessarily align with Aboriginal ways of knowing, being and doing, given the history of what's happened here in this country with Aboriginal women and feminism. So when the, that feminist movement was, and I was part of that myself, as a non-Aboriginal woman, that movement certainly did not include Aboriginal women. And I know there's a lot of evidence to say it deliberately excluded Aboriginal women, and it only concentrated on the rights of white women in this country. So while white women were, rightly for themselves, fighting for rights and for human rights, Aboriginal women were fighting for the right to be considered to be, a human in this country. Until very recently in the history of Australia, Aboriginal people were included in the Flora and Fauna Act. So while, women were marching for their rights, Aboriginal women were still considered to be part of the Flora and Fauna Act. So there is quite a difference between speaking from that perspective from this organisation. I mean, I've never worked in an organisation that is stronger in terms of the positioning of that matriarchal system and coming from that strong voice of Aboriginal women. But it's around Aboriginal ways of knowing, being and doing. It's around community, and it's around the whole of family with a matriarchal system very firmly in place. So how people, can interpret that, or which to analyse that, I guess, is up for debate. But I think there is a real difference between that traditional Western way of thinking about women's rights.
Yeah. Well, look, thank you. And thanks to both of you for explaining how you use different theoretical ideas and I know that you're so thoughtful about the way you provide the services. And I think people will see that from your service framework. So thanks very much. And I'll just very quickly conclude. And if you want to tweet at all, do #LancetGender. But I think it's clearly that theory-driven understandings and practices in relation to gender are vital and are a great basis for action. And I think in this commission, we'll use multiple theories and a lot of quantitative and qualitative data. And I think our task is to look at these complexities, look at the fact that one theory that might fit well in one situation really doesn't in another. And hopefully we can develop new understandings that will challenge existing power bases and provide a much better basis for understanding how we can promote gender equity. And my real hope is that when our report comes out, it will make the work of organisations like Wominda much better understood by people who fund services and more generally to be valued by the wider society. So thanks everybody, and I hope that's given you some food for thought. And thanks again to Faye and Cleone.
Thank you.
Yeah, thank you.
Enormous thanks from my side too. That was a really engaging and enlightening presentation that really, I think, really clearly captured both the history and the rationale for the approach that you've all taken. I wonder if I could just start the questions going, and I've got a couple of questions really around. First of all, when Wominda was first established, how important was it, do you think, that it was a women-only space rather than inclusive across all genders? What do you think the rationale behind that was right at the start?
Yeah, I'd have to say in our community, we did have other ACCHOs, so other Aboriginal community-controlled health organisations. So we actually had an Aboriginal medical service that's still established to this day as well, which is for men and women. And I feel that when Wominda first came to be and why it had to be women and women only is because women and women only, we know each other. We know what our community needed. And it comes from that place of, you know, women coming together, being connected, feeling safe as well. I think a big part of that is about being safe. And I know in our community, you know, we have strong men, but we have a lot of strong women, you know, who actually took up the fight and created our art shows within our community, and, you know, would go to, you know, really massive lengths to establish these organisations in our community. So for in saying that, so I feel like our women were quite active, you know, and very and activism as well. You know, that was pretty big in our community. And of course, we have our strong men, but I just feel at that time it was time for a space for our women, and it just, and that's where it came from. Yeah.
And I think just to add to that where women has come from, we talk about that quite a bit within our executive. We've got, you know, 4, you know, young, strong Aboriginal women as part of the executive of this organisation, and we talk about that need for having an Aboriginal women's led service hasn't changed. So it's probably become more and more important in this community where, you know, our voices need to be heard. Women's voices need to be heard, but Aboriginal women's voices need to be heard and lead conversations and lead change. And I think that's what I can see, is that there's massive change being forged ahead by the leadership of Aboriginal women, because we are led by Aboriginal women, we're governed by Aboriginal women, and that's just decolonising in its own right, that, you know, around that governance. So I think the voices are strong and being heard, and we don't have to compromise. There's no compromising here. Yeah.
And I think too, just to add to that, it was women's health as well. So, you know, to have women's health and to address women's issues, you need that safe place to come and do that. And so that's what it very first provided as well. Yeah.
Thank you. There's a few questions coming in, so I'm just going to throw a couple of additional questions at you before we move to closing this open part of the discussion down. And actually, this is a question about lessons that you would essentially, what lessons have you learned from the running the services and space for other health services? You know, what lessons do you think could be applied in different settings?
Lots. I mean, I think I could chuck in a couple of things. I'm sure Cleone's got a couple more, and I know time's limited, but I just think being unapologetic about, you know, your vision and your core purpose and your model of care and who you are. So, you know, being really quite upfront about that, having, you know, those systems in place that, like Cleone said, that don't strangulate you, but just make you stronger in terms of your governance. You know, having a really broad reach in the community so that, you know, you're meeting a whole of community need rather than just part of the community, and being really brave and courageous, to be perfectly honest. We take a lot of risks in this organisation, but they're calculated. You know, we mitigate them where we need to, but we're not scared of stepping into spaces and, you know, really speaking up.
Yeah. And I think too, just, you know, well, I can only speak from us, but like I said earlier, like being that community-led and being community, so therefore not separating yourself from community, and that means getting out in community, speaking to, you know, community and not leaving them out of the conversation. I think that could be a risk, or that could be something that is quite dangerous, you know, because you can, as a service, say, well, you know, we want to do this, we want to do that, but it's listening to your actual community's voices and what it is, what's the need from them.
So we've got a few questions as well for Fran, but I'm going to take the opportunity to come back to those later, and perhaps ask you a question that is drawing on some of the questions that have been raised. How important is it to you in Waminda to be engaging with the academic community? We know from the academic side how important it is for us. How important is it for you, if at all?
That's a really good question, and I think what we'd probably even flip that and say that it's really important for the academic community to engage with us. That we need to be in the driving seat around that, and we've established quite a strong and robust system around our research committee and our research agenda. We're really very protective and thoughtful about who is able to come into this organisation to work beside us in research. We've had some pretty terrible experiences of academics coming into this organisation and abusing that privilege of being within this service. So we're very we do a lot of research, but we've just come out of our research committee this afternoon. We look at what's presented in front of us, and people actually have to fill in quite a robust document before we even consider if we're going to think to consider the research or meet with the research team. So there's quite a bit that researchers have to go through. And interestingly enough, that actually probably weeds out, a good third of potential researchers, because they get quite, they're not overly happy about having to give us extra information that we require. So that probably tells the story. So, because we're leading our research agenda, therefore we're getting the research done in our organisation that we require, that needs to tell our story, that that is led by Aboriginal women in this organisation, to say, well, what do we need? What is going to assist us in, looking at our evidence and looking at the data that we're collecting and looking at, mixed methods and making sure the stories and the narrative are coming out very, very clear, and that, we're able to participate in those discussions, nationally and internationally, because we are engaged at that level, but we're very careful about that.
Thank you. That was very clear. And I just would really like to thank all three of you again. We're going to close the open part of the seminar right now. So thank you again, Cleone and Faye and Fran. And thank you to everybody who has joined us on YouTube, either live or watching this subsequently. And I would like to encourage you to subscribe to our YouTube channel so that you can find out about all the other exciting seminars coming up, as well as look back at the fantastic seminars that we've had over the past few months. Thank you.
Thank you.